All right. Well, hello and thank you for joining us today for the Cohort 2020 Kickoff Webinar. I'm Caleb Wozinski, and I'm the Outreach and Telehealth Coordinator with the DRCHSD program. Most of you have already received several emails from me over the past month. Before we get started on today's webinar, I wanted to do some housekeeping. The webinar today is being recorded and will be posted to our website. I will also send the recording and the slides to the participants. We encourage questions and discussion. Either unmute your line or utilize the chat box. If you are not speaking, please keep yourself on mute to cut down on feedback. If you have a camera, we ask that you please turn your video on. Now, I would like to turn things over to Kate Stenjum, Program Manager, to get us started. Kate?
Thanks, Caleb. And you can go to the next slide. Well, welcome everybody. Again, my name is Kate, and I am a Program Manager with the Delta Region Community Health Systems Development Program. My areas that I am over are outreach and telehealth, and I believe that I've talked to almost all of you that are on the line already today, and really looking forward to working with all of you over the next 3 years. So the agenda for today, we're going to do some welcome and introductions, and we have Rachel Moscato with us, and she has been our project officer with the Federal Office of Rural Health Policy since the inception of this program. And we also have Christina Wade, and she is the Health Programs Manager with the Delta Regional Authority. After that, we'll do some introductions with all of you on the line, the Cohort 2020 members. And then we're going to move into program purpose and goals. I'll go over that pretty high level, and then go into the 3-year program activity timeline. Shannon Norman, our consultation team lead, will walk you through that. Then it's going to return back to me. I'm going to go through some participation requirements and expectations. And then also the CEO Memorandum of Understanding. I know most of you have already signed that Memorandum of Understanding, but just wanted to walk through some details of that just to see if any of you had any questions on that. Then I'll turn it over to Selena McCord. She is our community team lead, and she is going to walk through the community champion role and expectations, as well as that champion letter of agreement. Finally, we'll wrap up with the benefits of participation and outline some next steps and see what questions you have. Like Caleb had noted, if you have questions along the way, please feel free to unmute yourself or to utilize that chat box. We want this to be an open discussion and dialogue, and for all of us to really start to get to know each other. Next slide, Caleb. And next one, thank you. So just a brief introduction for us. We are with the National Rural Health Resource Center, and the center is a nonprofit organization. We're dedicated to sustaining and improving healthcare in rural communities, and we've served rural hospitals, clinics, and other providers nationwide for over more than 25 years. We've collaborated with the Federal Office of Rural Health Policy for the last 20 years through various rural health programs to provide technical assistance to rural providers and their communities. To share just a couple of examples, we provide technical assistance to the state Medicare Rural Hospital Flexibility Flex program, which most of you are probably familiar with, as well as the state Small Hospital Improvement Program, the SHIP program, to help small rural hospitals across the country. We also have done the Small Rural Hospital Transition Project, which really assisted hospitals with financial, operational, and quality improvement. Next slide, Caleb. So the Delta Region Community Health Systems Development Program, it was put together by the Delta Regional Authority and the Health Resources Services Administration's Office, Federal Office of Rural Health Policy. They partnered to bring together this program. Through a cooperative agreement with the Federal Office of Rural Health Policy, the National Rural Health Resource Center, that is our group, administers the program and manages the provisions of services to the selected rural healthcare facilities and the communities. Services are provided through technical assistance, which, as most of you know already, includes various assessments, on-site and virtual consultations. Of course, most of our consultations, or all of our consultations over the last year, have been virtual. Action planning, coaching, and implementation of best practices, as well as adoption of key transition strategies. Next slide, Caleb. So now I'm going to turn things over to Rachel Moscato. She is the Deputy Director of the Hospital State Division of the Federal Office of Rural Health Policy. And she has, like I mentioned before, been our project officer of this program since its inception. Rachel.
Thanks, Kate. And I just want to start off by thanking all of you and welcoming all of you to the program. As Kate mentioned, I've been working on this since it came to be back in 2017. So to see now we're into our 4th cohort, it's just really, it's really rewarding, I think, for the federal level, for us to just really see rural hospitals making these significant changes and to see the impact that it's having on the rural communities that you're all serving. So, you know, I know given everything that's going on in the healthcare world today, this is a huge undertaking. It would be a huge undertaking no matter when you came into this program, but I think given all that we're dealing with right now with COVID-19, it's just even more so. So I commend all of you for taking the time, making the commitment and doing everything that we're gonna offer you in this program, because I think you'll really find that the hard work pays off and you'll see a lot of success come not only to your hospitals, but to the communities you serve. I'd also like to just take a quick moment. As Kate mentioned, I'm currently the Deputy Director of the Hospital State Division. I moved into this role in September, which means we were able to bring on a new program coordinator, project officer to fill my role as the program coordinator for this program. So Suzanne Snyder has joined our office. She just joined last week. So this is her first kind of jump into all of the information that we have in this program. So she's going to be learning along with all of you, but we're really excited to have her on board as well as we move through this next year of programming.
Okay, thank you, Rachel. Next slide, thank you. I'm going to turn things over now to Christina Wade. Christina is the Health Program Manager with the Delta Regional Authority, and she oversees DRA's health programs, including the Delta Doctors, Innovative Readiness Training, and this program, the Delta Region Community Health Systems Development Program. So, Christina.
Thanks, Kate. I'm Christina Wade, as Kate said, Health Programs Manager for DRA. And on behalf of the agency, we'd just like to welcome you into the program. We've worked with Kate and Rachel and the team for 4 years now, and we know that you'll find this experience, this program beneficial. I can't wait to meet all of you, hopefully in person one day within the next 3 years. And just looking forward to working with you all. Thank you, Kate.
Thanks, Christina. So this is a list of the Cohort 2020, the selected Delta communities that you will be in your cohort with. I just want to say quickly too, just want people understand why it is Cohort 2020 and not Cohort 2021. How our years work is from the end of September, so September 29th to September 28th. So it's a little wonky, but that's why it's called the Cohort 2020. So next slide. So we're going to go through and do introductions. If you could unmute yourself and tell us, I will call you down. I'll go down the list of the organizations for Cohort 2020. If you could, if the CEO is on the line, just your name, your exact title, and your organization, and also let us know where your organization is located. And if you could let us know how many team members are on the kickoff call today with you, that would be great. So we are going to start with Grove Hill Memorial Hospital. Grove Hill.
Good. Hi, this afternoon, everybody. My name is Doug Tanner. I'm the Chief Executive Officer of Grove Hill Memorial Hospital. We're a 50-bed hospital with 2 rural health clinics on our campus. I'm the only one on the call today because I looked at my calendar and I've got something to do with this grant every single day this week. Phone call wise. So we've got our planning meeting tomorrow and a kickoff on Wednesday with our entire leadership team. So I gave them a break today. So you've got me and me only.
That's great. Thank you so much, Doug. Monroe County Hospital.
Hey, this is Cynthia Martin in Monroe County Hospital. I'm the CEO. We have 3, maybe 4. I can't get a response from one, but I think we have at least 3 of us on the call today.
Great, thank you so much. Greene County Hospital.
Good afternoon, everyone. Can you hear me?
Yep.
Okay, great. I'm Marcia Pugh. I'm the CEO at Greene County Hospital. The hospital is a 20-bed hospital with a nursing home and a rural health clinic. I am also a registered nurse. So I have 3 members here with me. One of them is our financial manager, and we're very, very excited to be here. Thank you so much for this opportunity.
Yeah, thank you. We're glad to have you on. Thanks, Marcia. Missouri Delta Medical Center.
Good afternoon. Jason Schrupp with Missouri Delta Medical Center. We're a 125-bed sole community hospital located in Sikeston, Missouri. And I'm the president and CEO. I have 4 team members with us this afternoon. Vice President of Finance, Greg Sarda, Vice President of Nursing, Julie Frazier, Senior Vice President Jim Henson, and our Executive Director of the Foundation, Amy Alcorn.
Great, thank you so much, Jason. Perry County Memorial Hospital.
Good afternoon. I'm Chris Blibenmeyer, Vice President of Operations at Perry County Memorial Hospital. We're a 25-bed critical access hospital located in Perryville, Missouri. We have 4 rural health clinics, and I am the only member on the call today.
Great, thank you, Chris. Great Minds Health Center.
Hi, I'm Greg Roback. I'm the CEO of Great Minds Health Center. We're a federally qualified health center that serves 3 counties in Missouri. That's St. Francis, Washington, and Madison counties. With me is Rebecca Jones, the Chief Operating Officer, and then David James, my Chief Financial Officer, was going to be on the call, but I don't know if I see him on there. But we're glad to be.
Yeah, I'm here, Greg.
Oh, there you are, David. You were hiding.
Yeah.
There's David, and we're glad to be a part of this program. Thank you.
Very much.
Great.
Thank you.
Yeah, thanks, Greg. Washington County Memorial Hospital.
Good afternoon, everyone. I'm Michelle Meyer. I'm the CEO of Washington County Memorial Hospital in Washington County, Missouri. Neighbors to Greg and his team and Great Minds there. We have, I think, 7 people on the phone call today. Deb Pratt, and Steve Weiss, who represents finance, Amber Coleman, operations, Jennifer Ferguson, our CNO, Christy Abishan, who is our HR, Jessica Stacy over quality, and Laura Wells, who has responsibility. We have 3 rural health centers, soon to be a 4th one coming on boarded, and then an offsite therapy department. So thank you. We're excited to be joining.
Thank you. Thanks, Michelle. Claiborne County Medical Center.
Good evening. I'm Ada Ratliff. I'm the CEO of Claiborne County Medical Center. We're a 32-bed critical access hospital. I have 3 members on with me. The controller, I have my HR, I have my infection control and quality, and also my administrative assistant.
Great, thank you,
We're
Ada.
just excited to be a part of this program.
Yeah, we're excited to have you on. Urgent and Primary Care of Clarksdale.
Good afternoon. I'm Dr. Mary Williams, CEO of Urgent and Primary Care of Clarksdale. I have one other person on the call with me. We're located in Clarksdale, Mississippi, in the Mississippi Delta, home of the Blues. I'm so excited about this opportunity, and thank you for having me.
Thank you, Mary. Tunica Resorts Medical Clinic.
Good afternoon, everyone. My name is Barbara Conway, and I'm the Clinic Operations Officer with Tunica Resorts Medical Clinic. I am the only member on the call today, and we are a rural health clinic in Tunica, Mississippi.
Great, thank you, Barbara. Okay, next slide, Caleb. Okay, and we're going to go over next the program purpose and goals. And I just want to let all of you guys know too, we have, this is the kickoff call, of course, today. And then as all of you know, we have your 90-minute meet and greets with your individual organizations coming up over the next 2 weeks, either this week or next week. And that's when we're really going to dive deep into each of the program areas into a lot more detail. So just to let you know, today, we'll be a little bit higher level and going over some of the expectations, and then we'll do the deeper dive and with more of your staff on those meet and greets. So next slide, Caleb. Thank you. So, this program, really working with all the inspired leadership from all of you, developing those innovative collaborative efforts, and being able to provide access to that forward-thinking technical assistance to move you into the future. The Delta program is really positioned to help rural healthcare organizations continue to deliver your care in the face of, as Rachel, our project officer, had noted earlier, sometimes really overwhelming adversity. So over the next 3 years, you're going to work with our team here at the center, with the federal office, with DRA, and also have access to kind of the best in the business consultants on how to improve your financial, operational, and quality performance, how to really utilize telehealth to improve patient access to services, to really hone in on your leadership development and workforce needs, and to prepare your organization for that moving into the future, to build those connections and create community infrastructure to help you advance your rural healthcare and develop your community care coordination plan. And you'll also be able to really lean on our program staff, consultants, and all of your peers. Have that shared expertise, those resources, explore how organizations are really successfully navigating the current healthcare environment. And I'd just like to take a brief moment here. The bottom line, as you can see on this slide, is we're working to strengthen the local healthcare delivery system in your community and with your organization. But this is a team effort. We're all in this together. And like I like to say, it's kind of a cheesy saying, but teamwork makes the dream work. If some of you may have listened to one of our presentations where a CEO from our Cohort 2017 spoke, so they have been in the program for 3 years, and it's Iron County Medical Center, located in Missouri. And I think he said it so well, that program's not a magic bullet, but if you put the time and effort in working with us all together as a team, what can come out of it at the end is just actually, really extraordinary. So just really want to make that emphasis of that. We're all in this together, and we're going to be working very closely as a team over the next 3 years. Caleb, next slide. This is just a nice little visual kind of for the slide that I just talked through, emphasizing how we have that phased in approach with the technical assistance and working on how we build capacity through implementation of best practices and developing those partnerships for sustainability. And next slide. I'm going to turn things over now to my colleague, Shannon Norman, and she is our consultation team lead. Shannon.
Okay, good afternoon, everyone. I'll just take a few minutes now to walk through our technical assistance services for the next 3 years. Next slide, please. And so technical assistance services are phased in over 3 years to support sustainability. Go ahead and click again, Caleb. And technical assistance is provided through an intensive, comprehensive approach. The focus really in year 1 is on project development and kind of building that internal capacity. To do this, we use various assessments with follow-up action planning sessions and priority planning events. Then moving into year 2, the focus is on implementation of your action plans and priority areas through ongoing peer-to-peer educational opportunities and one-on-one coaching with subject matter experts, really to support leaders and providers in developing that local system of care. And then finally, in year 3, the focus is on sustainability, so that participating organizations are left with a sustainable plan in place following successful completion in the program. And next slide, please. So here's a Gantt chart, which provides another form of visual representation of Cohort 2020's program activities for the next 3 years. Now, I know at first glance, this slide can be a little overwhelming, so I'm just going to go through it step by step here. During each year of the program, selected organizations will host and participate in community action planning sessions with key community joint partners, and participants will also receive virtual and on-site assessments. One of the first activities in year one is the community champion selection and onboarding, which Selena will discuss in more detail momentarily. Also, for community care coordination activities, year one really focuses on building a comprehensive foundation to identify and connect with community partners. Simultaneously, participating organizations will be receiving a financial and operational assessment, as well as a quality improvement consultation through Stroudwater Associates. There will also be a telehealth consultation through Huron Consulting Group, and you'll be provided with an employee engagement assessment, an EMS assessment, and ongoing educational opportunities such as learning collaboratives, technical assistance webinars, and the annual summit. Those are kind of represented in those blue boxes: communication strategies, patient experience, etc. Then looking at year three activities, year two activities, which will begin in October 2020 for your group. Year two for community care coordination is aimed at addressing community and patient needs by aligning and maximizing community health needs with locally and regionally available resources. Additionally, you'd receive a revenue cycle and physician practice management consultation with BKD, CPAs, and advisors. Following the consultations, we'll provide what we call implementation support, which is really designed to help assist with implementation of your action plans. Implementation technical assistance opportunities include things like leadership development and management training, workforce development opportunities, and telehealth and financial system enhancement funding, among many others. We'll go more in depth on those during your meet and greets. Year two, again, is really designed to help implement process improvements to better position your facility. And then moving into year three, the focus is on monitoring progress, strengthening collaboration, and really strategizing for ongoing self-sufficiency and sustainability, really to ensure that diverse and vulnerable populations are benefiting from community care coordination. We'll also focus on reassessing each facility in the areas that we've mentioned for two purposes: really to spotlight the accomplishments that you've made throughout the program, but also to ensure that a sustainable plan is in place so you can continue moving forward once the program is complete. I'll now turn things back over to Kate. Kate?
Hey, Shannon. So next we're going to walk through participation expectations and that memorandum of understanding. So next slide, please, Caleb. Thank you. So as you guys can see from the slides that Shannon just walked through, the Delta program provides in-depth and comprehensive technical assistance over 3 years, and it's a very large and comprehensive program. So the Federal Office of Rural Health Policy and the Delta Regional Authority intentionally set it up to be very comprehensive. And I just want to be very transparent from the beginning and let you guys know too that you're not able to pick and choose which parts of the program you want to engage in. You must take part in all facets of the program. So you can't be working heavily on your financial stuff, but then not focusing on some of the community care or the telehealth, or you can't be focusing just on quality, but not on the employee engagement assessment pieces and the leadership pieces. It's very comprehensive and you have to be really in all facets of the program. So I want to go through all of this, and I know most of you have signed your memorandum of agreement, but I also just wanted to see if anybody had questions. So all the organizations, and you have been selected, you should be really willing, ready, and able to participate again in all program goal areas, be actively engaged in all facets of the program, build organization-wide and community support for program activities, really commit to working collaboratively with the community partner organizations to develop and implement your community care coordination plan, commit to participating in the multi-year program and work through long-term projects to meet the program purpose and goals, and ensure that your organization does not have any pending organizational-wide projects or anticipated issues that would hinder participation in the program. And one, just as a for instance, would be a system affiliation. The affiliated system has to support you in fully participating in the program and provide all necessary data to submit our requests and to complete our activities, which does include looking at audited financial reports. Next slide, please, Caleb. So as the Chief Executive Officer, you need to act as the program representative and work directly with us for planning, development, and execution of the program services. Participate again in the facets of the program that includes what we're doing today, the kickoff webinar, the meet and greets, the virtual and at some point on-site community care coordination, planning events, and consultation services, the assessments, the action planning sessions, the review calls, educational trainings, the technical assistance webinars, boot camps, our annual summit, which takes place in every September, as well as external evaluation interviews. You need to ensure that your leadership, department leaders, and community champion and other key staff are available to actively participate in the facets of the program as listed above. You need to prepare your management teams and key staff for active participation in all of those scheduled activities. Engage your board of director and providers in the program activities. Designate internal staff member, usually this is your administrative assistant, to schedule our activities through the program. This representative really needs to have access to staff calendars to make it as smooth as possible. And then work with the center to select and hire community champion, which Selena McCord is going to go over in just a little bit. Next slide, please, Caleb. And then your executive and management team should really be ready to, or need to be ready to, meet those program deadlines and project timelines, including those data requests. You'll be doing data requests for all of the different assessments, the financial operational assessment, the quality improvement assessment, the telehealth assessment. Those are the three big ones that you'll be doing within this first year. Schedule and hold mutually agreed upon dates, and once secured, we really ask that dates are not rescheduled. Communicate immediately if timelines can't be met due to circumstances, that are sometimes outside of your control. Maintain regular communications with our staff throughout the program. Obligate and commit necessary staff time to support and participate in all of the project activities. Ensure that virtual and on-site events and consultations start on time. The team members engaged to utilize time effectively and efficiently. Develop your action plans with a timeline and delegate actionable steps to your key leaders. Develop and implement a care coordination plan in collaboration with community members. Implement financial, operational, and quality best practice recommendations to improve performance and quality of care. Adopt value-based care strategies to participate in new payment and care delivery models. Utilize available resources and tools to support implementation of action plans. Share your successes and lessons learned with your peers. That might be through webinars, through summits. Sometimes, honestly, it's just even getting on a phone call together. If we know one site is struggling with something and we know this other site has done just a really good job with it, we'll connect them up and have you chat through it and share what you've done to succeed in that area. Submit your pre and post project values for all program areas as requested, and demonstrate measurable outcomes to show impact of services by participating in post-project follow-up activities. Okay, next slide, Caleb. So before I turn it over to Selena, I know this seems kind of tedious for me to walk through all of that line by line, but again, we just want to set the expectation. Again, we're all in this together. It's a really big program, and so we do need your really strong engagement in the program. And I just wanted to take a minute and pause and see if there were any questions on the expectations or participation. If there are none, everyone is so chatty when I get you on the phone one-on-one, and now everyone's so quiet. Okay, I'm going to turn things over to Selena McCord. She is our community care team lead, and she's going to walk you through community care coordination planning and the community champion component.
Thank you, Kate, and hello everyone. I'm so excited to be presenting with you today. It's been a pleasure to participate in your interview calls, and get to know your organizations personally. And I'm looking forward to be going along this journey with you for community care coordination planning, as well as building the capacity of your community champion. Next slide, Caleb. So as Kate mentioned, a large part of this program focuses on community care coordination planning, and it's a collaborative approach to help develop a local system of care. Through the program, we do believe in working with your community joint partners to establish a comprehensive foundation to enhance those care coordinations that you already have in place, or those care coordination efforts that you are looking for through this program to help you develop. We believe in taking a stepwise approach with this program, and it's the same for community care coordination planning. So we want to make sure that we're dotting all the I's and crossing all the T's. So we take year by year to do that with your organization as well as your communities. Our stepwise approach provides a tactical guide to planning, developing, implementing, and sustaining those collaborative outcomes between your facility and the community joint partners. So Shannon touched on it earlier, but through the stepwise approach, each year we have a high-level focus. And the first year is making sure that the community joint partners in your facility is all on board with community care coordination planning. So it's that opportunity to really form a strong connection from the very beginning to enhance ongoing efforts through this planning process. We believe in a process that involves establishing a forum, making sure that all voices are heard, and that we can begin to make collaborative decisions. So year one is really our kickoff for getting to know your organization, your community, and your joint partners and their primary priorities and concerns, and using that information to tailor community care coordination planning for the future. In year two, again, we're working with you one-on-one to make sure that the processes that we are aware of for best practices are used to collaborate that approach with your joint partners. We really look into the environment of your community. We take a look at some of the work that you've already done, as well as offer opportunities to gain more insight from your community to help begin the process of saying, okay, here's where we are. What do we really want to prioritize for our focus areas? And how do we action plan those for implementation? In year three, focus is on monitoring the progress. So by this time, we're expecting that the work that we have done with you and your joint partners, we're expecting to see accomplishments, successes, and we're wanting to make sure that you're able to continue that progress, strengthening your collaboration and strategizing for ongoing self-sufficiency and sustainability. Through the years, we will either be on site or we will conduct virtual events. Both have been very successful, as we have learned through our recent transitions in this COVID world. So we have had the opportunities to provide different experiences for our organizations to meet them where they are. Although I walk through an approach, this is really a process, and we do take into consideration the work that you've already done, and we do customize our planning to meet your needs. We do believe our process helps to build and strengthen community capacity, create partnership buy-in, as well as establish accountability. It's very important to note that the planning is driven by the executive team, and it should be operationalized within the facility's strategic plan. Next slide, Caleb. So another great resource from this program is the Community Champion. Participating organizations receive $7,125 per program quarter to support a Community Champion position. This person can be a contracted or half-time employee of your facility. The champion is expected to assist the organization in meeting community care coordination program goals by engaging the organization's leadership and joint partners in the community care coordination planning process. Next slide, Caleb. To formalize this type of service and funding support, we have a Community Champion Letter of Agreement, also referred to as an LOA. So each organization will receive a Champion Letter of Agreement. It is a formal document that is signed by the CEO each program year, and it outlines the intended funding support per quarter. It also breaks down into identifying how the champion is to be supported by the organization, as well as the champion's roles and responsibilities. Next slide, Caleb. So just a few things to highlight. You'll also have an opportunity to see this letter of agreement this week. So the champion will represent your facility as the boots on the ground person. Because of how much dedication and planning that is involved in the community care coordination process over the 3 years, the champion is expected to dedicate 0.6 FTE to champion roles and responsibilities. So for example, this does involve working under the guidance of the leadership team to direct community care coordination planning and implementation. This involves reporting to and updating leadership on community care coordination progress, or even barriers that may inhibit the champion from moving forward with community care coordination planning. It also involves facilitating communications between our center staff, your leadership team, as well as the community joint partners, and participating in all community care coordination program related activities. Participation includes, for example, coordinating and hosting the facility's community care coordination events. We also offer champion learning activities to again increase their capacity to be able to work to do this type of technical assistance that we provide as well, and quarterly progress reporting. The champion may participate in additional program activities where appropriate. However, involvement should not interfere with the progress of community care coordination planning. And I'll turn it back over to Kate. Thank you.
Thanks, Lena. Just wanted to take a quick pause there too, just to see if anybody had questions for Selena about the community care component or the community champion position.
Hey, Kate, this is Doug Tanner with Grove Hill Memorial. From your experience with other cohorts, what qualifications or credentials do the community champions typically have?
Yeah, that's a great question, and I'll turn it over to Selena and her team.
Hi, Doug. Thanks. That is a great question, and one that we have encountered quite a bit. So it really is varied. We truly want someone that is connected to the community, that has already established a level of trust, a person that can be a catalyst for change, someone that's ready to roll up their sleeves and market the hospital or the clinic's services, to be able to have communication skills as well. So it's a varied skill set that we're looking for in champions, and we do have documentation to help your organization as well as the others that are joining this cohort to identify that ideal candidate. To give you some more examples, we have champions that are clergymen. We have champions that are retired teachers, maybe a retired counselor. We also have champions that are working on becoming a nurse practitioner too, that are working inside of the hospital or clinic. So it really does vary, but it's important for that champion to really be a trusted person in the community and that understands what collaboration involves. We do our due diligence through this program in providing education to continue to build upon the skills that they already have, and to make sure that they understand all the different components that comprise of population health, and being able to facilitate conversations is a big part of this program as well. But we work with them to expand upon their skill set. Does that answer your question, Doug?
Yes, it does. Thank you.
Thanks, Lena. Any other questions? Okay, none at this time. Next slide, Caleb. So just to walk through some benefits of participation and some anticipated outcomes, this slide really summarizes the anticipated outcomes and the benefits of participation. This was also linked in or attached to your Outlook invitation. So you do have this as a handout, and the slides were in your Outlook invitation too, if anybody is looking for those. So anyway, these are actual outcomes that have been trending across the participating cohorts. Again, in order to achieve these outcomes, the organizations really need to be fully engaged in all aspects of the program. So I would encourage you to print off or just keep this as a handout, and you can look through that. But you can see, I'm not going to read through each and every single one, but looking at the outcomes of better coordination and services of care provided to the community, reduced bypassing of local businesses and healthcare services, increased alignment of services with community needs, enhanced marketing to better promote services and quality of care. And that's another component of the program that we'll talk a little bit more about in the meet and greet. But we also have access to call it community education and outreach. And we just recently did an 8-part webinar series with a consulting firm on how to really communicate your services and your messaging out into your community. All of those webinars are on our website now, so you can access any of those, as well as a really nice communications toolkit. But like I said, we'll get into a little bit more about that on your meet and greet too. So with that, next slide, please, Caleb. So I just wanted to take a quick moment to summarize the year 1 activities, because I know we tried to take this in little snippets, and so we're not coming at you with just a complete fire hose, and we'll break it down into even more in-depth steps and pieces on the 90-minute meet and greets. But in year 1, you can really be looking for hiring on that community champion and then onboarding that community champion with our team, and then doing the community care coordination connect events. We're doing your financial, operational, and quality improvement consultations, those assessments. And some of you may already have chosen dates and are getting the information on that as far as your data requests to get that moving forward. You'll be starting with your first employee engagement assessment. And then you'll also be doing the telehealth consultation or the telehealth assessment. So be on the lookout for that more information about the telehealth assessment and the dates to get that scheduled for your particular organization within the next upcoming weeks. We do an EMS assessment, and then like Shannon had noted before too, in that kind of off blue color, those are all of our different educational components. And so right now we're actually going through the telehealth series. In that first one, we just finished up the communication strategies and toolkit webinars, and now we're moving in the telehealth series. I saw almost all of you, I believe, were on the first one that was just this past week, and that is a 6-part series. So part 2 will be this week. Then we're going to be doing some patient experience webinars, customer satisfaction, value-based care webinar series, and then workforce and 3RNet Academy, and then our summit will be in September. So we do have a customer satisfaction assessment too that we do annually, and we really, really, really love to hear the good and the bad. You know, we want to hear back from you, and that's such a great way for us to take that information so that we as a team can constantly be working on our performance improvements across the program. So next slide, please. Thanks, Caleb. So just next steps, again, sign the memorandum of understanding if you haven't already. Hold your meet and greets with your executive and management teams. And then Bethany Adams is leading most of your meet and greets with the board of directors. And Bethany, most of you have probably met her before. She is our program director. So all of those will be happening within the next couple weeks, which is super exciting. Once you have that community champion on, like Selena said, you'll be signing the community champion letter of agreement and begin, moving into that hiring process and onboarding that champion. You will be scheduling your financial operational assessment and your quality improvement assessment, those consultation dates, if you haven't already, submitting those data requests for the FOA QI, and then initiating your employee engagement assessment. And that will be done with our colleague, Shannon Studden. So next slide, Caleb. So we've reviewed now high level, the purpose and goals of the program, expectations and timelines and next steps. So what questions do all of you have? Or if any of my colleagues and teammates out there have anything else that they would like to add in at this time?
Kate, this is Chris Littlemar. Who did you say will initiate the employee engagement assessment?
That is Shannon Studden of our staff. And Shannon, I believe she is on the line if you want to introduce yourself.
Yeah, hi. So I'm Shannon Studden. I am the person who kind of focuses on leadership and workforce development, Chris. Do you have specific questions about the engagement assessment?
No, I just wanted to make sure I had your name correct.
Okay.
Question, Barbara Conway. On the community champion, is this person going to be employed through the Delta Region Community Health Systems, or is that going to be an employee of, per se, the clinics?
Hi, to answer your question, the champion will be employed and supervised by the participating organizations. Our role at the center is to support the champion by providing them with education and training for community care coordination planning. But we will not oversee the champion or identify the champion for hire.
Will you assist in helping the sites employ this person, or give us direction of what type of qualifications this person should have?
Absolutely. So following today's call, you will receive communications from Rachel Wins Marcus. She will be working one-on-one with your facilities as well as your champion. And we will help you by providing a personnel packet. So this personnel packet will include a job description that also outlines some of those skills and assets that an ideal candidate would have. There's also an an interview question, as well as an evaluation checklist to help you narrow down those candidates that you identify. And then we can also support you if you have a list of candidates, or even two, to say, hey, center team, we've narrowed it down to two, but we really need your help into kind of confirming who would be the best fit. And we would be more than happy to walk through that with you. We have helped some of the organizations already in working one-on-one with potential candidates to further answer any questions that the champion may have that you may not be able to answer about the program. So we do offer assistance in helping you identify that candidate.
So, Selena, who pays for FICA or workman's comp? Does that come in addition from the grant, or?
That is the responsibility of the organization. The funding support that we provide is just that dollar amount that I mentioned, and that's for you to kind of disperse and pay the champion with. So what I didn't get a chance to talk about is just the invoicing process, and I won't go into details because we'll have a chance to do it in our meet and greet, but you will invoice the center quarterly for that dollar amount for the champion services that are provided. And there's more steps to go with that. And then that's how we will reimburse you that invoicing process.
Selena, this is Jason. Would it be appropriate to use a full-time employee in a part-time capacity for this community coordinator position, and then reassign, those part-time responsibilities to another employee, or hire someone to complete those duties that were previously done by this ideal candidate that could really perform well in this job description?
And I want to make sure I understand your question. So you're asking, can you appoint a full-time person for part-time champion responsibilities?
Yeah, so we already have a full-time employee, but if I could, delegate, some of those responsibilities to someone else already in the organization and use her in a part-time FTE capacity to fill this role, is that feasible?
We don't recommend the hiring or appointing a full-time person for the champion responsibilities. We suggest and recommend either a contract lay person or a person that works at the facility at half-time, because 0.6 of their time will be dedicated to champion roles and responsibilities. So we know there's a lot of time involved in community care coordination planning, and as well as the activities of the program. So we don't recommend a full-time person fulfilling part-time champion responsibilities.
And Selena, I want to clarify, this is Alyssa, because what I heard Jason also say is that they would reassign that 0.6 of the FTE to another employee at the hospital, because they have a person employed that would meet the skill set. So the 0.6 of that we're looking for the champion could be by this person. And so they would free up that time of that contractor, or excuse me, of that employee to be able to do that. And we've had other organizations do that.
That's correct. Thanks for the clarification, Alyssa. We have a person who's kind of in a community coordination spot already that has a lot of these relationships and connections built up. And so I would, have her do that, and then, delegate the 0.4 of her other full-time position to someone else within the organization, or hire a part-time to fill those responsibilities. So she should have that 0.6 dedication to this community coordinator position. That is correct. Thank you for the clarification there. So that would be appropriate. Is that correct?
Yes, we've had, yes. I'm sorry, Selena.
No, I'm glad you stepped in, Alyssa. I misunderstood the question. Thank you.
And I'd like to jump in on this as well.
Communication. So go ahead.
Yeah.
Go ahead, Anthony.
Yeah, I also want to just jump in here. I think that was a great question. And we have several great examples of hospitals doing just that. And it is very successful, because therefore it's also sustainable. And so if this is an approach to help you make it sustainable, that is more important to incorporate it into your strategies for moving forward, and be that representative for sure. Our concern is when the time is not delegated and activities moved. However, I would say everyone really makes an effort to do that. And then the ones that really have been successful and have demonstrated measurable outcomes and been very active and moving forward with their mission and strategies have done exactly what you just said.
Thank you.
Thank you. Great question.
Other questions? Well, next slide, please, Caleb. And you can go to the next one. This is our resource center slide. And then I just wanted to know, because there were some questions, we do have all of our contact information on here too for the entire team. This is the overall Delta team, and everybody is listed out on that last slide. So like I said, you have access to this. Caleb had included it in the Outlook invitation today, as well as that with that handout. So I just want to say for myself, I'm really looking forward to working with all of you over the next 3 years and getting to know you really, really well. This is just a really wonderful program. And every single aspect of it is unique, but at the same time, so supportive of all the other aspects of it. And so our team is really excited to get everybody rolling here in the next month, and look forward to those meet and greets over the next couple of weeks. So if there aren't any other questions at this time, I just want to thank everybody so much for your time today. Hope everybody is staying warm. It looks like it's supposed to be much, much better right now than it was last week. So I hope everybody's doing okay. I know I was in Arkansas last week, and it was not a good life choice to be in Arkansas last week. It was pretty entertaining to say the least, and a little stressful. So I hope everybody, all of you, are doing really okay, and your teams too. So with that, if there aren't any other questions, I hope you have enjoy the rest of your afternoon, and we'll all be touching base really soon.
Thank you, Kate.
Thank you.
Yeah, thank
Very
you.
much.